All right, welcome back to Midday. Along with our cold weather, viruses appear to be having a field day. Cases of influenza, the common cold, COVID, and measles are all being reported right now across North Texas. We have asked our medical expert, Dr. David Winter from Baylor Scott & White, to give us his take on all the illnesses swirling around and how we might do or how we might end up protecting ourselves a little bit better. Welcome, Dr. Winter. How are you doing today?
Doing well. Good to be with you.
All right. So like we mentioned, a lot of sickness going around North Texas. You start feeling icky, gross. What do you recommend? Just get tested or stay away from folks? I mean, we just, kind of gone through a pandemic. I think a lot of people know the routine here.
Well, first, let me remind people that most of these viruses are spread through the air. The large majority spread through the air. Small from contact, doorknobs, tabletops, kitchen utensils, but the vast majority are spread through the air. So be careful when you're in a crowd, particularly if you're around people that are coughing or sneezing. Also, flu, COVID, influenza, those all kind of run together. Common cold fit in there also. They have similar symptoms. And so when people call, say, I want some treatment for this, I say, we need to get a diagnosis because I've got good medicine for COVID, doesn't work for the flu. Good medicine for influenza doesn't work for COVID. So we need a diagnosis. So testing, I encourage for lots of folks that call in with symptoms.
And so, yeah, those symptoms, like I said, they could lead to anything. Do you recommend getting testing so that you can help doctors narrow down what exactly is going on?
Yeah, I think it's a good idea. Now, not everybody has to be tested. If you're in good health otherwise and you have mild symptoms, you can do fine at home. Over-the-counter acetaminophen, cough medication, get plenty of sleep, hydrate well, and most importantly, stay home. I don't like these folks that tough it out and go to work. You're not doing your coworkers a favor when you spread the virus to them.
Yeah, and so obviously we are in flu season right now. The CDC, everyone's tracking it from, I believe, October until we start warming up later in the year. But why do you think so many infections are being seen right now, not just from the common cold and the flu, but also the measles too? I mean, we're seeing a lot of a mixture of things here.
Yeah, these viruses tend to change. They mutate, and a new strain comes out. Many of the new strains are mild or just like the one before, but this one is a very virulent strain. The CDC said it's the worst they've seen in 30 years, and right now we're up to 210 million people that have gotten influenza in America. There's been now 210,000 deaths, or hospitalizations rather, and 13,000 deaths so far from the flu. So this is a bad one that's going around. It still hasn't peaked yet. So if you haven't had a flu shot, it's a good idea to get one because they do help to prevent severe cases of the flu. And this one's going to go on probably for several more weeks, maybe even another month or two.
Last question here for you, Dr. Winter. We are seeing some more cases of measles being reported, specifically out there in our western counties. Why is that? I know that this is something that we don't always worry about. It's in the back of our mind, but why more cases this time around this year?
Yeah, Matt, to me, this is a sad story because in the year 2000, measles was declared extinct in America, no cases at all. Last several years, we're seeing a resurgence of measles because parents aren't vaccinating their children. The measles vaccine works extremely well, lifetime immunity when you get the first 2 shots as a child. And right now, we're seeing a lot of measles coming back, 58 cases in West Texas right now. Measles can be bad. It's the most highly contagious virus on the planet, we're told. If a young child has measles, walks to a classroom with a bunch of kids that are not vaccinated, 90% of them will get sick within the next day or two. So highly contagious. I encourage people to vaccine. The deal is, overall, I say the message is that these viral diseases, they can be tricky to treat, but they're easy to prevent with vaccines. Matt?
Really great things to consider there from Dr. Winter. Thank you so much for joining us, and have a great Thursday. Stay warm.
Thank you. Good to see you, Matt.